not too long ago, cybersecurity, as far as healthcare was concerned, was largely about privacy. Now we're connecting medical devices, digitizing records, et cetera. Everything is kind of remotely accessible. How has this changed the way that you, as a security leader in the space, how you strategize, how you prioritize, what's important in your program? It's a big job now.
In terms of priority, it's really about what the organization wants to accomplish in terms of how they want to use technology to deliver patient care. So for us, the priority is really understanding what they want to do strategically, and then building a cybersecurity program that enables them to achieve their mission. And that looks very different now than it did, a couple of decades ago in terms of interconnected devices. But ultimately, it's about looking at the risks that are associated with those technologies, implementing appropriate security controls where possible, and managing the risks through other means such as contracts or compensating controls or education to the business, or really just sort of juggling the different ways that we can manage risk to ensure that the business is still achieving the outcomes that they intend.
Just to play off your answer there for a minute, you mentioned controls, compensating controls, et cetera. One of the themes, especially here at the conference, is that vulnerability management isn't really working anymore. Does that really emphasize other mitigations for you as a leader?
Vulnerability management is still a really important component of our program, and it is definitely something that we still focus on, especially when it comes to the zero-day threats that are already being exploited, and so sort of making sure that we have the means. But to your point, that's not going to solve all of the problems. And so really understanding how to layer the defenses such that the threat actors might be able to exploit one thing but not really achieve their intended outcome because they can't get beyond the other layers it's a strategic component for us. And doing things, in terms of shifting liability to our third parties where possible, requiring them to implement security mechanisms on their end, such as delivering patches on a timely basis, not 9 months to a year after the exploit is discovered. And so, again, a juggling act of using all of the tools that we have in our bag to drive down risk.
So, as a security leader, there's a lot happening in terms of connectivity, the cloud, different technologies that bring efficiencies, but leaders aren't supposed to say no. You're supposed to kind of enable the business, find a way to do things securely. What are 2 or 3 things that you emphasize that are kind of like non-negotiables in terms of security? I mean, is it basic hygiene stuff, or does it go beyond?
So I don't know that there's anything that I would outright admit is non-negotiable. Really, it's about having a conversation with the clinicians and the business leaders who may want the thing that might be of concern, and educating them on the risks associated, and not talking about the cybersecurity risks and the fear, uncertainty, and doubt, but if the risk that we've identified is realized, here's what you will experience. Here's what your patients will experience. Here's what the outcome may be, in a way that speaks to them and what they're looking to accomplish. And once they hear that clinical outcomes might be at risk, or that patient harm may be a potential scenario, it's easier to have the discussion with them about alternatives, or back to the compensating controls, some of the things that we may be able to do. Sometimes it's a matter of me saying to them, we can manage this through the contract, but if the vendor pushes back, then we're going to have a different discussion. There are certain things like cloud-based systems and SOC 2 Type 2 reports, or other third-party attestations that we look for. That often becomes a conversation with our clinicians if they're not available, because then we can't really see what's at risk. But we are now at a point where we've had these conversations so often that they understand. When they see me scheduling a call, they sort of understand what the discussion's going to sound like.
So I know you've done some work in terms of like extending the hospital perimeter to a patient's home, for example, just for remotely for diagnostics, for other treatment plans, et cetera. I'd love to hear a little bit about, what you can share in that regard in terms of the problem set, the challenges, how you address them.
As a matter of premise, we as an organization really believe that the closer that we can deliver the care to the patient's home, in their community, with their loved ones, there to support them, we're going to have better outcomes. And ultimately, that's what we're all here for, is to deliver the best health outcomes that we can deliver. And so in that vein, we're really looking strategically at the capabilities that we can employ to push the care out to the home. And so one of the initiatives that we're endeavored in is this notion of hospital at home. Instead of admitting a patient into a hospital room after a specific set of procedures, send them home. But send them home with the hospital bed and on average 17 medical devices that are usually connected to the walls and to the patient. And the unique set of challenges there is that they're no longer connected to our network, yet we still have to do security. We still have to do all of the things that we do when those devices are in our four walls, yet we don't have the visibility that we normally would. So at this point, we've engaged with a third party to help sort of deliver on those capabilities. And now we're thinking about, as we mature in this space, we need to bring those capabilities in-house. And how do we architect a secure environment that can still deliver on the strategic components while giving us the visibility that we need? We're not there yet, but we're certainly working towards it.
That's going to be a huge challenge, though. I mean, like you said, you don't own the home network or their connection, their provider, everything.
It is a huge challenge, but it's also an exciting one. For me professionally, I feel like if we can figure this out and create an architecture and a framework that perhaps we can deliver to the rest of the healthcare provider industry that they can adopt and use for the same reasons, then that's a pretty cool legacy.
That's a win.
It's a huge win for the industry.
Right. All right, great. Thank you so much.
My pleasure.